Ennis, Dr. Ennis, and to those who are online from the media and elsewhere. Welcome to an unusually timed COVID conversation. Unusual because a lot is happening. We missed a discussion last week, and we felt, as we normally do when appropriate, that it was appropriate to give an update before our normal Thursday date. So we apologize for any inconvenience this may cause, but we do think it is important. In the last 24 hours, there were some 49 new cases of COVID-19 infections in Jamaica and one additional death. This brings the total number of infections since the first case was discovered to some 88,480 and to 2,184, the total number of deaths, unfortunately. We also have in excess of some 512 persons hospitalized, 340 positive for COVID-19, and another 172 that are suspected. We certainly would like to have no one. The trend is suggesting that it is coming down, which is positive, but nevertheless still have to be cautious and concerned and continue to advise that we observe protocols to bring the numbers down further. At the same time, up to 9 a.m. today, our vaccination numbers were now up to 899,344 doses administered. That's 899,344 doses. Of that number, some 535,861 were first doses and 317,672 second doses. And for this Johnson & Johnson, 45,811, which is a single dose application. I wanted therefore, having given these basic numbers, I invite the CMO to expand a bit on the current status of COVID in the population, as we normally do. CMO.
Good morning, Minister. Morning, everyone. So our update with our figures as of yesterday, the 25th of October. So we, as Minister had said, we confirmed 49 new cases, and our total number of cases now 88,480 cases. Confirmed one additional death, and we're at 2,184 deaths. So our daily positivity rate yesterday is 8.3%. First, we've been below 10% in a long while, and our 7-day average 13%. In terms of the number of cases, you will see from the blue lines that the numbers are going down. The pink line on the graph is showing our admissions, and again, these have been going down steadily. Here we want to highlight the red line that shows the number of deaths, and again we have been seeing that these have been going down gradually. So just looking at the number of deaths that we've had from the 1st of March up until the 24th of October, we've had 1,651 deaths. And just to point out here, the value of vaccination, 98% of persons who have died are unvaccinated, meaning they have received no dose, neither first nor second dose. We've had 1% of persons that have been partially vaccinated, actually less than 1%, were partially vaccinated. That means they received one of a 2-dose vaccine. And then we had 1%, again it's really less than 1%, of persons also that had received 2 doses and had passed. So these deaths are being investigated. We are looking at the relationship, the time relationship when the COVID was diagnosed, and of course the type of persons that are affected. But again, very, very high numbers of persons unvaccinated. 98% of our deaths are persons that have not been vaccinated. In terms of the admissions, we can see that our admissions are going down. We're just a little above 400 persons, both confirmed and unconfirmed cases that are admitted to hospital now. So in terms of the persons that are hospitalized again, using the data, we report this day, we get this data daily. So this is 1 day's look, 98%, and this is what it has been continuously, between 97 to 99% of persons hospitalized are unvaccinated. We had 62 out of 63 who were moderately ill that were unvaccinated. 1 person that was moderately ill was fully vaccinated. We had 37 persons out of 37 who were severely ill, were unvaccinated, and we had 20 persons out of 22 that were critically ill that were fully vaccinated. In terms of our reproductive rate, we can see that the reproductive rate has been showing a little bit of up and down over the last couple of days. This is a stark reminder to us that we're not out of the danger zone. The value constantly being below 1, of course, is showing that there is decreased spread in the population, and we really want to keep that below 1 in order for our numbers to go down and to stop transmission. In terms of our weekly positivity rate, this graph looks at the 3 surges that we've had, and we can see that for the highest and the last surge, which peaked in August, that we are going down, but we also can see that with our 8.3% positivity rate today, the weekly positivity rate being 13.7%, that we still need to get into the green zone, which is less than 5%, where we can be more confident in looking at restrictions and reducing restrictions. In terms of our vaccination coverage, what is to be highlighted, the 60 to 69 and the 70 to 79 are almost 40% having received at least 1 dose. And this is very good, but still quite a way to go. This set of persons, the over 60, still remain our most vulnerable group, and therefore we need to get their vaccination coverages high. And you notice that in the over 80, it is less. It is only 28% of persons that have received 1 dose. So we need to get that up. And for the rest of the population, the numbers are lower. And these are the persons that will transmit to the most vulnerable persons and will result in their hospitalizations and deaths. So everybody needs to get vaccinated. The numbers are still low, and we need to get these numbers up. And looking at it right across the country, we will see that certain parishes are not doing so well. Generally speaking, we have low rates of vaccination right across the country. But even so, of concern is that in some of our larger parishes like Clarendon and St. Catherine, we have 84% of the population that is unvaccinated. And this suggests that in these parishes where you have larger numbers of persons, more denser communities, that the possibility of outbreaks of COVID-19 within these communities are high because there's a high level of unvaccination. We have parishes like Portland and St. Thomas that are even higher, 86.2% unvaccinated in Portland, 87.8% unvaccinated in St. Thomas. So certainly these are areas right across that we need to increase, but in particular, these areas need to be increased. Persons need to go out and get their vaccine. So overall, in terms of our indicators, we still are at a medium level in terms of the communities that are affected. 46% of communities are affected with new cases with yesterday's data over the last 2 weeks. And we still have a very high pressure on our hospitals with over 400 beds occupied. We want to get that below 100. We're still at a high level of transmission. We're at 13%, we want to get to 5%. And we are happy to see that our reproductive rate remains below 1, and we need to keep it that way. And then our level of vaccination is still low, that it is not having a good effect on transmission. So Minister had indicated the numbers, 899,000 vaccines that have been doses that have been administered, which is about 580,000 of the population would have received a first or all the doses for vaccines. So in terms of what we've been doing over the last couple of weeks for October, we're seeing that there's a decrease in the take-up of the doses, both the second doses. Many persons are still due their second doses, and we're seeing that we have less persons coming out for the second doses. We start and then we had 26 sites that were in health centers that were not fixed sites. We had 15 mobile interventions, 81 community outreaches, 8 private sites were operational. We started our shut-in operations to visit persons, so we had 34 visits that were done. The private sector vaccination initiative had 11 sites that were operating, and the Ministry of Health and Wellness in addition had 3 additional sites. So 247 sites were operational last week. So persons really just check our webpage to see where these sites are. There is one close to you, so it is available for you to get your vaccines. So for this week, we are concentrating our efforts in terms of the second doses. Many persons would have gotten a call to come out. All the health departments are calling out persons. In addition, text messages has been sent out, and persons should have received a text message. So you might have received either a call or a text message, or if you have not received and you know that you have received vaccine before the 31st of August, then you are due your second dose now, and you need to come out this week to get your vaccine. We're continuing to expand our fixed sites with more days at the health centers that we have vaccine offering, and we continue to do our mobile outreaches and our community outreaches. Additionally, for this week, we are starting to put in other private practitioners to come on board to give vaccines. So in terms of, there are some questions that have been asked, and I'm using this opportunity to provide some of the answers with regards to the vaccine. First of all, much of what I have to say is coming from advice from the SAGE committee, and I just want to say that the SAGE, our strategic advisory group of experts on immunization, was established by the Director General of the World Health Organization in 1999 to provide guidance on the work of WHO in respect of immunizations. SAGE is the principal advisory group to WHO for vaccines and immunizations, and it is charged with advising the WHO on overall global policies and strategies ranging from vaccines and technology research and development to delivery of immunizations and its linkages with other health interventions. So some of the questions asked. The additional dose for the immunocompromised. And here we have to make a difference, to make a distinction between an additional dose of a vaccine versus a booster. So an additional dose of a vaccine is given if we think that the persons having received the primary immunization have not mounted an adequate response. So the SAGE committee met October 4th to 7th, and coming out of that, they have recommended that moderately and severely immunocompromised persons should be offered an additional dose of WHO emergency use listing COVID-19 vaccines as part of an extended primary series, since these individuals are less likely to respond adequately to vaccination following a standard primary vaccine series and are at higher risk of severe COVID-19 disease. No recommendations from the SAGE has been received as yet in terms of the time intervals for this additional dose. Some manufacturers, such as Pfizer, Johnson & Johnson, Moderna, have recommended time intervals for what they consider to be booster shots, and these time intervals could be used. But no time interval has been given for the third dose of the AstraZeneca vaccine as yet. And we anticipate that the full recommendations from the SAGE will be out shortly, and that we would see what that time interval is. Now, some countries are using a 6-month time interval, and so it is very possible that this 6 months is what will be used. Now, the first set of persons who were vaccinated here would have received their second dose of vaccine in May. So they would be approaching a 6-month period in November. Now, the group of persons considered immunocompromised, so far the information that we have: transplant patients, patients with active cancers, persons on chronic dialysis, persons with severe primary immunosuppressive disorders, AIDS patients with cell counts less than 200, and persons on immunosuppressants for other disorders, such as high-dose steroids and methotrexate. Now, persons to which this applies are asked to obtain a letter from their physician to verify this, and the physicians who treat these special populations are also asked to contact the health departments and to submit the names of their clients so that we can make arrangements in the appropriate time period for this third dose to be delivered. And we will provide further updates through press releases. The other issue is in terms of booster doses. And remember now, what I've spoken about before is an additional dose. This now is a booster dose. So this is where persons would have developed an immune response, but over time, the immune response would have waned. Now, and they are given boosters. This is common in our immunization programs that we do for our children. Many of our childhood vaccines are given boosters. Now, at this time, there is no recommendation supporting boosters that is coming from the WHO. And the emphasis is on the administration of primary doses to as many persons as possible. Now, the vaccines continue to show high levels of protection against severe illness, hospitalizations, and deaths after primary immunization, and also against the variants. And this is why there is no recommendation, and I must emphasize at this time, because we know that as time passes and more studies are done, then persons do want to ensure that boosters are given at the appropriate time. But right now, the vaccines have been shown to be holding up, and so there is no necessity at this time for the booster. The other question is in terms of the mixing of vaccines. And again, I have to say at this time, there is no recommendation for the mixing of vaccines. The recommendation from the WHO is to take the same vaccine as your second dose, as the one that you had as your first dose. Now, we note that mixing is happening in some countries, and the information is changing as more studies are done. A second dose of Pfizer after AstraZeneca has been shown to produce good response and have been found to be safe as well. And this is promising, but larger studies are needed for us to formulate recommendations. And we expect that the anticipated SAGE recommendations will provide further guidance. Now, we have 85,000 Jamaicans that are due a second dose of Pfizer and are understandably concerned. Now, these persons, in a matter of days, will receive their second dose. Second doses, where indicated, are essential for stronger and longer lasting immunity. Studies have shown that there is a better antibody response with delaying the second dose. So persons should be confident that they will have a good immune response, and they are encouraged to get their second doses when it becomes available. Thank you.
Thank you very much, CMO. So you've gotten a lot there to digest and to understand. I'm sure there'll be some follow-up questions. The issue of boosters is an issue that has been talked about a lot, and the clinicians led by the CMO have been looking at it. I know there are different approaches that have been adopted in other countries, as she has said, and we'll be happy to provide further details during the question session. Also want to just raise your attention to the fact that the DRMA is coming to, the current orders are coming to a close. The Honorable Prime Minister will address the new measures which have been the subject of cabinet deliberations and consultations appropriately. He will address those specific issues in the Parliament today, and so the country will be briefed on that. The other point I wanted to raise is the issue of the number of sites. We continue to urge and encourage persons to get vaccinated, both their second dose or, in the case where they have none at all, their first dose. And we are adding significant number of sites. Currently, on any given week, there are over 200 sites across the country, and that slide that was put up, which lists the sites, I think is worthy of note. I don't know if you can find that slide, which showed the 200 plus sites and the breakout of those sites, both fixed sites as well as, there they are. So fixed sites, 54. This is now October 17 to 23rd, 247 sites. Mobile sites, shut-in operations, locations that have been established by the private sector vaccination initiative, the private companies that have been engaged and that are active, the community outreach, 81 of those, and all told, I think should clearly indicate that there is an effort, a collaborative effort involving multiple stakeholders, the health team in the field, private sector, and multiple methods, fixed versus variable versus mobile, to try to get as many persons the opportunity as possible to get vaccinated. And I'm going to speak a little more to that shortly, but there should be no excuse, which is the point I'm trying to make, for anyone who wants to get vaccinated. If you are immobile because you are bed-bound, wheelchair-bound, economic restrictions to move to a location, we have a method of contacting the parish offices where you can be visited and vaccination applied. you can visit a site that is close to you, a fixed site, or you can respond to any of the other initiatives in the private space where you can go to a particular private institution. So there are options. And I really think that the excuse that is given in the past that we need to provide more outlets is not or no longer the excuse that can be given with credibility around persons who have not taken up the vaccines. Now, I want to raise, in continuation on this issue of vaccines, the issue of the Pfizer, which the CMO touched on. So I know that a lot of persons, 80,000, have been waiting on their second dose of Pfizer, and there have been some concern, unease, discomfort around that particular brand not being available, having used up the over 200 plus doses that we received from the United States, gifted to us. And then the uncertainty around the second shipment, which we are still discussing and are hoping to receive in short order. I am happy to announce today that we now have confirmation based on other arrangements, not the amount that is being gifted through the US, but other arrangements to receive between now and the weekend some 145,000 doses of Pfizer vaccine, 45,630 courtesy of the government of Suriname, which we have been having discussions with that country on for some time over the past, week and a half probably, involving the health officials, the Ministry of Foreign Affairs and Foreign Trade. And that is now a completed discussion, and I believe the team has been dispatched to that country around private arrangements, private transportation, private charter, if you will, to retrieve or to benefit from that donation and to transport that amount to Jamaica under the strict guidelines to ensure its preservation and integrity. So that would be 45,630 doses of Pfizer vaccine. The other amount, 100,620 doses, will be made available through our paid arrangement through COVAX, the COVAX facility. As you know, we have an arrangement we have paid into, which is part of the collaboration involving the WHO and PAHO for us to receive a certain amount of vaccines over a period of time for a particular cost. We have received some. This represents another shipment. I think it's about the third or fourth shipment, fifth shipment from the COVAX window. In this instance, we are getting Pfizer. In the previous cases, we got AstraZeneca. So we're getting 100,620, and we expect that this amount will get to Jamaica during the course of this week into the weekend. So all told, 145,000 doses we expect of the Pfizer vaccine coming into the island this weekend. We intend to commence distribution of Pfizer on Monday, November 1st. This is Monday coming. Once we get in, it's a matter of logging, storing / distribution to the respective regional authorities, and therefore that will take a day or two. We would like to be ready Monday, November 1st to start distributions. Now, very important that the priority will be, in the first instance, to deliver the Pfizer vaccines to persons who have already gotten their first dose. So if you have not gotten a dose, you should not try to get a dose of the Pfizer vaccine at this point in time. I mean, there are others out there, Johnson & Johnson, AstraZeneca, and we'd certainly encourage you to take one of those two others. But the the 80,000+ persons who are waiting on second dose, who are all due. And as we had said, it is within the 12-week period, so the first dose would have still had its impact. The efficacy of the combined dosage would still be intact. You will now have your opportunity to take the second dose of the Pfizer starting Monday, November 1. We are encouraging those persons to make an appointment. We know who you are. We have you in our database on our web portal, and we will administer this particular brand of vaccine to second doses in the over 200 vaccination sites that will be available across the country. And we are asking that those appointments be made effective Thursday, October 28th. That's a day after tomorrow. You can begin to make those appointments for your second dose starting Monday. Clearly, we won't be able to give all 80,000+ persons on Monday, so it will be over a period of time based on the available slots, based on the appointments that are made. Sorry? Right. And of course, you can call the 888 number, 888 One Love number, also reappointments. Now, again, I want to urge that if you don't have an appointment, it is best not to turn up, because we are prioritizing second dosers. We will stock at locations the numbers of vaccines that are linked to an appointment. We're trying to avoid the rush, because we know there is some anxiety out there, and you can afford to wait. There is time, and over the next week, maybe two, all the persons who are due their second dose will be able to get that second dose during this period of time. So I'm appealing to the public, to those who are a part of this process or will be a part of this process, just to exercise some patience and allow the process to take its course. We do anticipate that we will get the amount that has been committed through gifting from the United States, hopefully sometime in November. And of course, when that date is determined, we will make you aware of this. Once second doses are completed, the intention, the policy as described by Cabinet, I want to be very clear on this, is to administer the balance to our young people, our students, ages 12 to 18 years. They will be the one, not just given priority, they will be the ones who will be exclusively will benefit from the rest of the Pfizer vaccine. And this is in keeping with the revised policy approach to give our young people, in anticipation of securing them sufficiently for face-to-face classes, which we hope will begin in the near future. So for persons who do not fall in that category, I'm going to urge you, please do not attempt to secure, and if you can't, having made that attempt, please understand that the health team are carrying out the policies of the government of the day, the cabinet decision, and that will be the approach that will be adopted for the Pfizer brand beyond the second doses who are due, the 80,000+ second doses who are due. So hopefully that information will ease some of the tensions and the concerns that Jamaicans waiting on the second dose will have. That wait will end going into this weekend, and starting next week we will begin to administer Pfizer. I want to also raise the fact that we have, and you would have seen the news item carried, been formally advised by the government of the United States that the remaining allocations will be provided with a specific date. I see here November 7th. Right. I would probably not commit to that date. I would say sometime in early November, because the conversations are still ongoing. All right, up to the 31st of October, some 73,000 persons are due their second dose of the COVID-19 vaccine, the AstraZeneca. We continue to urge those Jamaicans who are due their second dose, of course, to take the second dose, to use the opportunity and to go out and to take the second dose. I want to also just remind you that for those who are holders of non-immigrant visas, non-citizens traveling to the United States, you are going to be required to take, to have your vaccines up to date in order to access that jurisdiction effective November 8th. That's the announcement coming out of the United States. And so for those of us who are planning to travel or who would like to have the opportunity to travel, even if they're not planning, are holders of non-immigrant, non-citizen permits / visas to travel to that country, you would want to get your vaccine status current, meaning getting your single jab in the case of Johnson & Johnson, double in terms of AstraZeneca or Pfizer, as the case may be. Because otherwise, if you have to travel to the US after November 8th, you won't be able to unless you can demonstrate that you have had your full doses. The rule from the US is all WHO approved vaccines, which means that the vaccines that we apply here, AstraZeneca, J&J, and of course Pfizer, would be accepted. So Jamaicans don't have to be concerned about that once they take any of the vaccines that we offer and they have completed their dosage, then they would not have a problem. Hopefully that will be some encouragement for those who are still considering the vaccines as to whether or not to take it. Just want to reassure them that the vaccines are safe, and in fact they are safer and better off if they take the vaccines. One other important announcement. So we had said that we are increasing the number of opportunities, outlets for persons to benefit from vaccines. And as I said earlier, October 17th to 23rd, we have had 247 sites, and we went through those sites. Well, I'd like to announce that Cabinet has agreed with a recommendation that will see, in the first instance, an additional approximately 100 private doctors who will now be in a position starting tomorrow, Wednesday the 27th, to administer COVID-19 vaccines. That 100 private doctors have been determined on based on collaboration or discussions with them, working with the Medical Council of Jamaica, the Medical Association of Jamaica, and these are doctors who are registered with the Medical Council of Jamaica and are approved by the health department in the respective parishes in which they operate, and would be supervised, oversight provided by, of course, the public health through the parish offices and under the guidelines of the immunization regulations. So these doctors would have agreed, based on the procedures that are established in law around immunization, and based on their availability and willingness, they will be offered or provided the vaccines, and they will offer those vaccines free of cost to their patients. Each of them, of course, these doctors will have a cadre of patients that they treat, and they will be able to offer the vaccine starting tomorrow, Wednesday, 100. Now that number may change as necessary or as more doctors are available and are willing to participate. But for now, based on the conversations that we have had, we will begin with that 100. Now, this, as I said, is a collaboration with the Medical Doctors Association and also with the private sector vaccine operationalization task force, the Prof. Gordon Shirley task force, and the Ministry of Health and Wellness. And I want to just recognize and say the efforts has been a very collaborative one, involving, of course, private, public sector. And we're hoping that Jamaicans will take advantage of the additional outlets that are going to be made available. And where they need advice from their physician, they can, of course, have those discussions to guide them in terms of the decision. It means that we are further expanding outlets. That's really what it means. Beyond the 247, for example, between October 17th and 23rd, we're saying 100 additional or 100 private doctors will get doses of the vaccine and can offer the vaccine within their private practice based on certain guidelines. Jamaicans should therefore have no excuse to accessing the vaccine if access was an issue. And of course, we will continue to provide a narrative to support the importance of taking the vaccine. All right, so the CMO has spoken about booster shots, so I think for now we'll close and ask or take any questions that our persons may have. Stephen.
Thank you very much, Minister. Just reminding our media colleagues to use the raised hand feature on Zoom to pose their questions. We'll begin with Kimon Francis.
Morning. 3 questions. Just want to be clear in terms of the number of doses of AstraZeneca that we have sought to procure through COVAX. Also, Minister, you mentioned that the US is likely to give us a donation in mid-November. When we receive that donation, will the ministry continue its policy of administering the Pfizer vaccine to both adults and children?
All right, so I thought I'd address that, but just to repeat for emphasis and clarity, we are hoping to receive by this weekend, I believe you were referring to Pfizer, not AstraZeneca, some 140, just make sure I have that, 143,000 doses of Pfizer. Priority number 1, second doses. Beyond that, exclusively to our young people between the ages of 12 and 18 years. That's the policy, the revised policy of the government, of cabinet, that we're going to focus Pfizer because that's the only one that's approved for our young people. And in the interest of returning to school, face-to-face classes, the priority will be on them. Now, we will start with what we have, the 143,000, but we do anticipate that the U.S. donation will come while we are administering this 143,000, and therefore we will have sufficient to continue the program. And that donation from the U.S. is approximately 400,000, just over. That's the next lot, and then 200 after, yeah. So we'll get 206,000 the next tranche, and then we have another amount to get. So once we get that shipment from the U.S., we will continue that program. But as I said, second doses first, then exclusively to the young people after. Right. Right. So I'm being told that the 12 to 18 age group is approximately 240,000 Jamaicans. So once we have completed that cohort, then we will look at where we go from there in terms of any additional amounts. Okay, but the policy right now, just to be absolutely clear, second doses who are waiting, young people 12 to 18, review after we have satisfied that critical cohort in the interest of face-to-face classes and to secure them for that. Thank you.
In terms of procurement through COVAX, how many doses?
I didn't get the first part. You mean overall?
Yes.
Overall, it was 960,000. But yeah, it's clearly a mix. I'm going to ask the PS to just deal with the specific numbers.
So good morning, everyone. So the COVAX facility is an arrangement that we have made for the acquisition of different types of vaccines, depending on the availability of those vaccines to the facility at the time. At this point in time, there are variations of vaccines that are available in the facility, to include Pfizer, AstraZeneca, Sinopharm, etc. And so each round of negotiations, once the supply becomes available to the COVAX facility, they present to countries the possibilities for vaccines that are available, and the country makes its desire known in terms of types of vaccines that they would require in country. And so at this point in time, we have at the front end of the facility received AstraZeneca. But now that we are at this stage, there are different proposals to country around the type of vaccines that we are to receive. As you would have heard, 100,000 doses have been allocated in this round for Jamaica of the Pfizer vaccine.
All right, thank you.
The final question was an update on the electronic vaccination card. Can we get an update on that?
Let me ask the PS to just comment on that.
So the Cabinet has given approval for the negotiations with a solution out of India for the development of the electronic vaccination card. The collaboration is with an NGO out of India that has developed a solution that they are utilizing in other jurisdictions. And we will be utilizing that engagement in collaboration with UNICEF, which has been our partner in the electronic vaccination aspects of the program. The anticipated timeline still remain the same. The solution that is being contemplated is called a DIVOC solution, and we intend to have the complete vaccination electronic card, ready for our jurisdiction within the timeline that was stipulated before. One of the most important things that we're going to do in November, however, is a exercise on validation of the vaccination program, of the vaccination information. Now, many persons would have come in at the front end of our vaccination program and would have given information around their names and other biostatistics relating to them as a person. And so we need to validate all of this information as we move now into an electronic environment from our manual environment, which is the manual card that you would carry around. And so there's a process that we will speak about next week, where we're going to invite persons to validate their information that is existing in our database to ensure that your name is spelled correctly, your date of birth is correct, your address is correct, and any other information that we have for you is accurate and as accurate as possible, so that when we upload this information to the electronic card, then we have the exact information that is relevant to you. Thank you.
Thank you very much, PS. Thank you, Minister. I'm going to go to Althea Saunders from Jamaica Observer.
Hi, good morning. Can you hear me? Can you hear me?
Yes, go ahead, please, Althea.
Okay. Well, Kimon actually asked the question I wanted to ask, but just a bit of a follow-up. Minister, if you could just remind us of what the timeline is for the digital cards, and in the interim, for persons who want to travel to the US, the paper cards that we're using now, are we good to go with that? That is acceptable?
Right. So the timeline we had given, and we're still holding to that, the end of the year, December. We should be well down the wicket, if not, well, hopefully having that system available for usage. Given that Cabinet has approved, we now have a roadmap. We now are engaged in the discussions, as PS has said, and it's just now to work that through. And it's a government-to-government arrangement. So there are some diplomatic channels that have to be triggered to make that process work. In the meantime, the cards will suffice, the vaccine cards that are being distributed. And so what I would advise is that persons ensure that they get vaccinated and complete their vaccination process. If they have a single shot, get the second dose of the 2-dose vaccine, so that card becomes important for them to travel to the US in this instance after the 8th. That card is being used elsewhere in Europe. People travel every day, and so it will hold until we make the transition.
Just a quick follow-up. What's the cost of the contract that you're entering into with this Indian company?
As I said, you want to just go through the details of it. As I said earlier, it's a government-to-government arrangement. But let me ask the PS, who is part of that team, to give you a little more specifics on it.
So at this point in time, the arrangement is, as the Minister just stated, a government-to-government arrangement, and it is the cost for the solution. There is no cost for the solution at this point in time, as it is through a non-governmental organization in collaboration with the government of India that we will be launching our platform for the electronic vaccination card.
Thank you very much. PS, thank you, Minister. So Shamila Pullen from TVJ is asking, is the ministry looking at just one way of acquiring herd immunity, which is through vaccination, or are there other ways? And what about those who have contracted the virus and are better now and are immune? Is the ministry keeping a track of those persons, and how is the team doing that?
Let me ask the CMO to take that one on.
Well, we certainly know the number of persons that have been infected. We report that daily, so we know how many persons in the population would have had some natural immunity. The issue, though, is that we don't know how long the natural immunity will last. Some persons have said up to 6 months, but persons have different issues that could result in them not stimulating a strong immune response. So it's not reliable to say 6 months, but certainly that's the figure you would see in a lot of the documents that are around. So we know those persons have been infected, but as I said, you can't add them together and say that, okay, I have 800,000 that have been infected, and I have 580,000 that have gotten the vaccine. And so therefore I have 1.3 million of persons that have some immunity, because there would be overlap. You would have some persons who would have received the vaccine who would have had the infection, and then you also cannot depend on the fact that they've had the infection. We had our first case in March 2020, and that is now over 18 months. So that immunity would have possibly have waned, so we can't rely on that.
Thank you very much, CMO. We're going to go to Cassius Watson from Jamaica Social.
Hey, good morning, folks. Two questions, please. One, it could be taken by the CMO on both, but what is the current percentage of the fully vaccinated? And where will the second doses that we've been talking about, both if all of them are furnished or fulfilled, of the unvaccinated, of second doses, where would that take us, or percentage or overall numbers, or closer to the goal of the 1 million by the end of November? That's one question. The second question is specifically to the CMO. Are you for or against the relaxation of measures for the upcoming holidays? As we've seen, as we get some form of relaxation, we spiral into another wave. And that's been consistent over the past 3 major holidays, extended holidays. What are your thoughts on relaxations at this time heading into Christmas? Thank you.
Oh, okay. Yeah. Okay, so you're asking me to do some maths here. So we have 899,000 persons that have received a first dose and a single dose vaccine. So essentially, if we would have about 580,000 persons that would have received either one dose of a 2-dose or a single dose. So if all those persons receive their second doses, then it would be 580,000 persons, which would be approximately 22%, I believe, of the population that would be fully vaccinated. 22, about 22%.
Okay. All right. On the second question of relaxation of measures, as I said earlier, the Honourable Prime Minister will speak to those measures in the Parliament in the usual format, the usual approach. When one set of orders expire, then he addresses the issues based on the advice he has received and the discussions and decisions at Cabinet, and announce measures going forward. So I would not want to preempt that process. I would suggest that you listen out later on today for those details. Thank you.
Thank you, Minister. Thank you, CMO. We're going to go to Aladdin Love from CVM TV.
Hi, morning. Hearing me?
Yes, go ahead.
All right, 3 quick questions. The minister 100 additional private doctors to administer vaccines. How many are there currently? And also, could you provide an update on the shortage of the BCG vaccines? And is there a shortage of any other vaccines? And also, the CMO just addressed natural immunity, that immunity might wane after a period, but how long does immunity from the vaccines last? That's it.
All right, so you've asked a couple of questions. I'm going to ask Dr. Ennis to deal with the vaccine shortages, ECG or otherwise, and then the CMO could address issues around immunity. I wasn't sure what you were asking about the private doctors. How many are there? We announced 100. You mean how many in the country in total?
No, she wants to know how many private doctors are already existing.
Well, we use private doctors from time to time in our blitz, working with the association, the medical doctors associations. They are at the arena. They are in some of our sites that when we go out. We also use, as you know, we issued an RFQ some time ago, and have brought on board a number of private entities, which involves private doctors. So some of the private hospitals, the medical complexes, pharmacy in the case, pharmacies, a few pharmacies, and they have engaged the respective practitioners to administer vaccines. So the principle is not new. What we are doing now, however, is expanding to include a group of doctors who are willing, because one of the things that we have not said, which should be said, is that not everyone is willing. In fact, the consultations we have had many who say they are not willing or interested or able to. So it's really finding those who are willing and those who obviously will follow the protocols to ensure the integrity of the process. And we're starting with this 100 as announced. All right, Dr. Ennis, you want to speak to the issue of vaccine shortages?
Yes, thank you, Minister, and good morning, everyone. With regards to our routine immunization program, we have had delays in the arrival of some of our vaccines. We had a stock out at the national level. However, there was adequate supplies on the field. So we had low levels of the polio vaccine as well as the BCG vaccine. However, shipments of both vaccines have arrived in country. I know 2 parishes were out, just Kingston and St. Andrew and St. Catherine, and they have received doses of oral polio vaccine and BCG, and the persons who would not have received at the time are being called to come in for their doses. So we don't have a shortage at this time.
All right. Thank you very much. I'm going to go to Prince Moore from RJR.
Hello, morning. Sir, this had mentioned that some joined the vaccination program this week. Would you be able to say how many more will come on stream? And Dr. Tufton, the Nurses Association of Jamaica is complaining that some of the nurses who worked during the COVID blitz, they have still not received, they have still not been paid. Could you give us an update on that? What's causing the holdup and when they will be paid?
All right. The first question, you're breaking up a little on the first question. Oh, well, I think we addressed that earlier. We said it depends on the willingness and the capabilities of the particular doctor's setup. So we've announced the ones that are agreed to start with, and if more come on board, we're flexible and we'll address. We're open to that also. I'll ask the CMO to comment on that, and then I'm going to ask the PS to comment on the issue of payment, because I don't know that we have any outstanding payments, but that's administered at the level of the administration. So let me ask the PS to address that. But after you, CMO.
Right. So this engagement of the private doctors in their offices is purely voluntary, and it is going to follow the same process we have used for the expanded program of immunization for childhood vaccines. So the doctors would have been part of, the doctors that we are going forward with are doctors who would have been part of that system already. So their offices would have been assessed before, and they would have been found to have the necessary things to be able to manage the cold chain and to safely administer the vaccines and to be able to deal with any kind of events that may arise, as well as they would have had a history of submitting reports. And so that process is already in place, and so we are going back to that process in terms of getting persons on board. So all doctors who are in that position are able to indicate their interest and to very easily come on board with this, okay, because they've already been assessed, they're already part of the system. No, and we have a lot of doctors who are in that position, so they just need to indicate their interest. So far, we have only had a few that have indicated their interest, but I'm sure that once the program has started, many more will come on board, and weekly we will see more people coming on. For those persons who have not been a part of the vaccine program before, it is important for you to indicate your interest, and some of those persons, we would have gotten their names, and the health departments are reaching out to them, and I know that some of those offices are going to be assessed today based on a schedule that I see. So the other persons who have not been a part of the program are invited to reach out to the health department so that they can be assessed to ensure that they have the necessary things to safely deliver the vaccine to our population.
The issue of the outstanding payments.
So, thank you very much, Minister. I am not aware of that issue. I have reached out to the regional health authorities, regional directors, to get a sense from them whether or not there are nurses who have not been paid. But from the center, we do not have any issue around payment of nurses at this time.
Thank you very much, PS. I'm going to go to Zara Burton from 18 Degrees North.
Thanks, Stephen. Good morning, everybody. My question is for the CMO. I wanted to ask the comment you just made a while ago regarding the vaccination level. You said it's still low and it's not having a good effect on transmission, and yet the numbers are obviously trending in a positive way. I wanted to get an understanding from you. Of course, I know we've had lockdowns and curfews still, but we've had this for quite a bit. So I'm just wondering, just overall, what do you attribute the trending in a right direction to? If you have to say, if it's not vaccination and if it's not, well, I don't know what you think it is, please.
Somebody had asked earlier, and I'm just recalling the question now that you've asked your question, what it is that we will depend on to reach a point where we're comfortable if it's only vaccinations. So the preventative measures are going to include the public health measures in terms of infection prevention and control. And an important part of those public health measures is behavior modification and general acceptance by the population of this, that this is a new normal in terms of the adhering to the infection prevention and control measures. So far, it is the infection and prevention and control measures, the public health measures in terms of containment, and the restrictions that have been contributing to the numbers going down. What we have seen is that certainly there is a trend for the proportionate numbers of the over 60 age group. While they still remain the largest numbers that we have severe cases and deaths, proportionately the numbers are falling in terms of that. And so it does indicate that with their 40% of the 60 to 69 and 70 to 79 age group that have received at least one dose, that is contributing to the decrease in the deaths from COVID-19 in this age group. So vaccination is having an effect that we can see in terms of hospitalizations and in terms of deaths. In terms of overall transmission rate, the transmission level within the population, vaccination is not at the level yet where we would be seeing that it has an effect on transmission, but certainly a positive effect on hospitalizations and on deaths. So it is really the restrictions, those public health containment measures that are having that effect now. And you really want to get to a point where you normalize some of those in the population, and then with the vaccination levels going up, that you're able to keep transmission down.
Thank you very much, Seymour. We're going to close with just two follow-up quickly from, well, one, Prince Moore. You can go ahead with your follow-up.
Dr. Tufton, we know that some of the AstraZeneca vaccines should expire at the end of this month. Are you optimistic that those vaccines will be used up before they expire? What's the possibility of that?
Well, we present the facts as they are, and we observe the protocols around vaccine and the administration of vaccines, and we try as best as possible to provide the narrative, the messaging, and of course the outlets, which is why I've been at pains to say during this session that we have 200+ outlets across the country. We are now offering 100 private doctors starting tomorrow, Wednesday, the 27th, a number of days before the end of the month, and therefore really expanding the opportunity for Jamaicans to take the vaccines. We do appreciate, and for us it's unfortunate that
The hurricane season runs from June 1 through November 30. It normally peaks between August and October. Be prepared.
Do not park your vehicles under trees, power lines, or low-lying areas. If you can, fill the gas tank of your vehicle and make sure your spare tire is in good condition. Keep a small emergency kit with food, water, and medication in your car in case you are stranded. Do not take a chance and drive through floodwaters. Even 6 inches can be dangerous. Do not drive around barricades put up on roadways. Pay close attention to advisories about closed roadways and bridges. Avoid driving on bridges that are over fast-moving water. Monitor your radio or television for weather updates and instructions. Be prepared.
If it is not, then clearly we will be disappointed. But it would be a commentary on all of us, because I do believe that the health team are doing the best that they can under the circumstances, that they are out in the field, that they are providing outlets, they're working with stakeholders, in this instance the private sector, They're providing the messaging. I don't think there's any Jamaican who is not aware that vaccines exist. They're around. They serve a particular purpose. And it is in your best interest to take the vaccine. And it is available at a location near you. And so we would be disappointed, but we would have to press on and continue to tweak the messaging, tweak the approach and the strategy. And I think some of that you will hear later on from the Honorable Prime Minister also. So I'm hopeful.
Thank you very much, Minister. Those are all the questions we have from the media. I just hand back to you for your closing remarks.
Well, I think I've said the closing. I think I've addressed the closing remarks. I want to thank those who came online in this instance for this unscheduled, if you will, unusual press brief around the COVID response. Thanks to the CMO, the PS, and of course Dr. Ennis online and the team who have prepared the presentations, the slides, and so on. Continue to encourage Jamaicans to go out and get the COVID-19 vaccine as we seek to restore normality. We seek to live with COVID, which we will have to live with for some time, but get our kids back in school, get people back at work, get our social events going again. The vaccines globally, and I believe you will see more of it locally, are now determining and defining how we operate as a people. And to some extent, those who benefit from particular privileges, if you will, and those who may not, based on their vaccination status. The clearest example of that is being imposed on us by virtue of decisions taken in our neighbors and friends, the United States of America, saying unless you're vaccinated, you can't visit if you're a non-resident. That, to my mind, is a significant commentary on where the world is going. And it sets the stage, I believe, for variations of that, including locally in our own population. You're going to have a party should the vaccinated alone be allowed. You're going to have a football match should the vaccinated alone be allowed, even that they are in a safe space, or create a safe space to enjoy the things in life that you're accustomed to. And so I really want to urge those who are not yet decided. I think there's enough evidence to suggest that the vaccines are safe. Many of us, 6 billion administered throughout the world, many of us in Jamaica, nearly 900,000, maybe 900,000 doses administered. And, we're all here. The hospitalization and the deaths show that it is those who are not are the ones who are most vulnerable. And so really want to use the opportunity for the next couple of days for persons to go out, get your second dose. There is a location close by you. And those who have not yet gotten a dose, go and get your first dose, because this represents the surest way to bring us back to normality. In addition to that, Pfizer vaccines will come in this weekend, and for those waiting on their second dosage, please feel a little more relaxed now. You will get your dose. Just make your appointment starting on Thursday and attend to that appointment that is made, and you'll be provided. You will be the priority. Then, of course, it will exclusively be for the 12 to 18-year-olds. And finally, 100 doctors, private doctors, being added to the process, hopefully to provide greater outlets for the vaccines. Thank you very much, and we will keep you updated in the days to come, particularly with the arrival of the Pfizer vaccine and the information that is required to set those appointments so that our second doses can benefit. Thank you. Have a good day.